events and moral lessons from Islamic history. Advice from Fudail ibn Ayyab.
He once said in a sermon, addressing both the young and the old, "O group of young men, I have come across many crops that were defective even before they grew up. O group of old men, are crops harvested except after they become ripe? And what are you waiting for? And what excuse do you have to present? What will the young and the old among you say when Allah, the All-Knowing, will say,
Did we not give you lives long enough, so that whosoever would receive admonition could receive it, and the warner came to you? Gems and jewels. Wise sayings, interesting events, and moral lessons from Islamic history. The best ones.
The Messenger of Allah, sallallahu alaihi wasallam, said, "From my nation, the most merciful to the believers is Abu Bakr. The strongest of them upon Allah's religion is Omar. Truly, the most modest of them is Uthman. The best judge among them is Ali ibn Abi Talib. The one possessing the best recitation of Quran is Ubay ibn Ka'b. The best concerning inheritance law is Zayd ibn Thabit. The most knowledgeable of them concerning forbidden matters and lawful matters is Mu'adh ibn Jabal. Greenery has not given shade, nor has the earth carried one with a more truthful speech than Abu Dhar al-Ghifari. Every nation has a trustworthy one, and that one for this nation is Abu Ubaidah ibn al-Jarrah."
Broadcasting 24 hours a day, 365 days a year. This is Salam Radio.
Assalamu alaikum. This is Dr Shabina Asad Qayyum for Salam Radio 106.2 FM. How are you all? It's wonderful to have you back again on Wednesday, 7 p.m. for the Body, Health and Mind show, which I think is one of the best shows on Salam Radio, but I may be biased. I'm joined by my wonderful team, who comprise of the station manager, who is Sister Michelle Bushpati, and we've also got Zachariah, who's doing some work experience with us, who I gave a shout out to 2 weeks ago and said to him that maybe I wouldn't this week, but yes, I've ended up giving him a shout out. So it's wonderful to see you all. How have you all been? I hope that you're customizing yourself to this beautiful crispy autumn weather that is upon us. And I am indeed seeing lots of upper respiratory tract infections, colds, coughs, and a lot of you come in for antibiotics. And the word has to be said that don't start antibiotics immediately. It's most probably a virus. Plenty of warm fluids. Keep out of the cold and enjoy some nice company with your family at home. Now, as always, you know who I am, Dr Shabina Asad Qayyum. I'm a local GP in Peterborough, and I know quite a lot of you through the radio and through the work that I do here on behalf of the wonderful team of Salam Radio. And I try my very best to bring on board the cream, as it were, of specialists throughout the country. And we have one such specialist, and when I introduce him, you will definitely agree with me that he's a highly accomplished specialist from the world of ear, nose, throat surgery. But before I introduce him, it would be wonderful if you could text and WhatsApp us on 07745278978 or ring us on the studio telephone number of 01733 602 133. Now, talking about ENT, we thought it would be a good idea to discuss something in the way of sinus problems, nasal and airway problems, and for that I have a wonderfully accomplished consultant, and I'm going to introduce you to him now. His name is Mr. Ali Qureishi, and we use the word Mr. for surgeons, in case you didn't know. A lot of them end up being called doctors, but they are Misters because they're a special class of their own. He's a consultant ear, nose, throat surgeon at the John Radcliffe Hospital in Oxford. He has a specialist interest in rhinology and anterior skull-base surgery, performing complex rhinoplasty and nasal reconstruction, alongside advanced open and endoscopic sinonasal surgery. He also has a general ENT, adult and paediatric practice. He graduated from King's College in 2009 and completed his surgical training in the East Midlands and Oxford deaneries. He has completed an NIHR academic fellowship, resulting in the award of an MD, as well as fellowships in medical education at Oxford University and rhinology and skull-base surgery in the Thames Valley region. He's currently the anatomy lead for head and neck at Oxford University. He's authored over 30 peer-reviewed publications and has received numerous national prizes, including the ENT Masterclass Gold Medal and consecutive awards at the Royal Society of Medicine. Mr. Ali Qureishi, Assalamu alaikum.
Oh, walaikum salam. Thank you for having me.
It's wonderful to have you on board. In fact, I was reading through your intro and thought, goodness gracious me. You only just graduated in 2009, and this is 10 years on. You're a consultant at one of the most well-established centres of ENT in the country, and you have so many publications under your belt. It's wonderful, it really is. Thank you so much for your valuable time in joining us.
Oh, no, thank you for having me. I feel very fortunate to have achieved the things I have, and yeah, thank you once again.
Oh, it's brilliant. Oh, actually, with great interest, we have another ENT consultant who'll be watching, who happens to be my other half, and he actually knows you because he looked through. I said, wow, look at all of this. And he did say to me, he said, oh, I know Ali very well. And he said he's a very intelligent young man. So we look really forward to seeing what you can sort of educate our masses in regards to ENT and everything. So what actually made you, well, this is something that I ask all my specialists that come onto the show, what made you want to come into ENT surgery? What was it that actually attracted you to this field?
Well, it's interesting. I mean, it's an interesting story to me. I wanted to be a heart surgeon, actually, and I applied for a special study module in cardiac surgery when I was at university, and I didn't get it.
Okay.
Instead, they gave me a place on an ENT attachment at Guy's Hospital.
Right.
And I went to see the surgeon there, and I was so impressed by how he was and the kind of cases that he did, and the fact that he worked with children and adults, and there were so many interesting gadgets and tools that he used that as a young student, I found that really fascinating. And actually, after that point, as a third-year medical student, I didn't look back. I always wanted to do ENT after that stage.
That's amazing. Well, that's really interesting. You should share that. I started off in ENT as well before I became a GP. Things changed once I settled down and had my family. And my first experience in ENT is doing a rotation. And back in that day when I was doing ENT, they used to use a hammer to break down the nasal cartilage. I'm not sure if they still use that, but this was somebody having a rhinoplasty done. And I slowly felt the blood drain from my head and feel myself lightheaded. And 5 minutes later, I was on some hospital bed in recovery. So that was my experience with ENT. I got used to it, but unfortunately, I never quite made the registrar sort of rotation, simply because of the fact that I had to take a change in speciality, which was general practice, because the children came along. But it's wonderful to see you. And of course, we are talking a little bit about our about sinus problems. So it's very basic when we talk about information, giving information to our listeners, and we like to talk a little bit about the anatomy, etc. So would you like to tell our listeners a little bit about the nasal cavity and its anatomy, though you are the lead of anatomy at Oxford University, which is brilliant, so you'll be perfect at it.
So I think that the way I like to think of the sinuses and explain it to my patients is to think of your sinuses as rooms inside a house. So there's an upstairs and there's a downstairs. And the upstairs sinuses are located in the forehead, where they're called the frontal sinuses. And there are 3 other pairs of sinuses that then sit along the floor. And they all connect into a main corridor, which is your nasal cavity, which goes along through the floor of your nose. And when you look inside your nose, if you ever look inside your nose, you'll be able to see a right and a left nasal cavity. And that's the corridor that essentially connects to each of the rooms, which are your sinuses.
Okay, and that's quite easy to understand. Now, your nasal passages are connected to these rooms, and often what can happen is if you suffer from an infection, etc., they can become clogged up, can't they, with mucus, etc., which
Absolutely.
can lead to. So, in terms of the different, what are the function of the sinuses in the face? Is it to equalize sort of air pressure, or?
Well, that's a good question. I mean, I don't think we fully completely understand what the actual role for the sinuses is, but there are a number of theories. There's one theory that suggests that sinuses are there to allow the skull to be lighter, because if it was solid bone, then the head would be a much heavier object. It would put more pressure on the neck muscles. Another theory is that the sinuses act like crumple zones. So if there's any trauma to your face or your head, they can absorb some of that trauma and protect the brain. Other people say that it may be to do with how we speak to help our voices resonate. But we don't really know for sure what their role is.
Okay.
But I do know that they do seem to cause people a lot of problems.
Yeah, they do, especially when they come across in general practice, and then we're sort of right till the very end. We think, no, we can't refer this yet to the ENT surgeon, but then we end up having to with the more serious cases, obviously. But it would be good to talk a little bit about some of the problems associated with the sinuses, or those that cause nasal congestion, as it were. We have the nose in itself, and we have some fleshy outgrowths known as the turbinates, don't we? Would you like to explain to our listeners what the functions of the turbinates are?
Well, when we breathe air in through our nose, the fleshy growths that are inside our nose, called the turbinates, help to warm and humidify that air. The idea is that prevents cold air from going inside into your lungs and helps to prevent irritation of the chest or potentially chest infections. The lining of the nose is also covered in a mucus lining, and that helps to trap any dust particles or potential pathogens or bugs that may be entering into your nose and therefore into your lungs. So it acts to warm and humidify and potentially protect you from infections. That's the main role for those turbinates.
Okay, that's great. And we have a whole range of conditions that can affect the nose, from obviously rhinitis, which is nasal congestion, excessive mucus production, and that can be related to allergies, and it can be related to infections as well. I think it might be a good idea for us to talk a little bit about allergic rhinitis.
Yeah, so allergic rhinitis is a very common condition, and it affects adults and children. It can happen all year round, and when that happens, we call it perennial rhinitis. That's usually in response to things like house dust mites. So many children may suffer from that, and we do see them, and I'm sure you see many of those in your practice.
Yeah.
The other type of allergic rhinitis is also known as hay fever, and it's seasonal rhinitis that happens during the spring, summer or autumn time, depending on what the person's susceptibility is to whichever type of plant that they're sensitive to. And that's when we recommend patients to use medications like antihistamines or nasal steroids and douches to help manage those symptoms.
Okay. And with regards to sort of this perennial nasal allergic rhinitis as well, there's a lot that sort of we can do. I do get a lot of patients that say to me that we've tried nasal sprays. Usually it's Beckinase, and usually we advise them to buy it over the counter. And they say to me that sometimes these nasal sprays don't work. Is there some truth in the fact that Beckinase, what I've heard is that Beckinase is systemically absorbed more in comparison to its sort of other sprays like Flixinase, for example, or Avamis. Is there some truth behind that?
Well, I mean, there's basically three main types of steroid sprays that we use. There's mometasone, which is one of the sprays, and then there's fluticasone, which is a slightly stronger one. Out of the two, the fluticasone, which is a flixenase, has more of an absorption into the bloodstream. But actually, the absorption is very low. I mean, we're talking about less than 1% of the actual steroid getting into the bloodstream.
Okay.
And we don't want it to get into the bloodstream. We want it to get into the lining of the nose. One of the common causes that we see in the hospital for patients' nasal steroids not working is either the patient is using the spray incorrectly.
Mm-hmm.
For example, when they spray the nose with the spray, they point it towards their septum, which is the thing that divides the right and the left nostril together. That can cause pain and irritation in some patients' cases and can lead to nosebleeds.
Okay.
Patients will stop it. It's important to point the spray outwards. So when you put it in your nose, you should try and point it towards your ear on the same nostril, and that helps to spray a greater area within your nose.
Okay. And would that be, obviously, if the patient in particular is pointing the spray towards the outer part, would you suggest that the funnel of the spray has to fully be inserted into the nose, or just sort of towards the outside to facilitate that?
I'd say just slightly inside, so not all the way inside, because that can be quite uncomfortable. But I think probably about 0.5 centimetre inside would be enough to allow the spray to go in.
Okay.
And there's different types of sprays, as you probably know. Some of them squirt quite a direct stream. Some of them produce more of a mist. And so some of the sprays that produce a mist, one of those is called Avamist. I'm not an advocate of any particular medication, but that produces a mist, and that can be quite useful for patients who have not responded well to Beckinase, because Beckinase tends to spray in one particular direction, whereas the Avamist produces a cloud that coats most of the nose.
Okay, I see. We do have a question that's come up from a sister, Sidra Farouk, who's asked, what can you use if you're pregnant?
Well, generally speaking, if your symptoms are severe enough, then you can use a nasal steroid spray inside the nose, but it's not something that's generally recommended on the medications themselves. If you were to look through the advice leaflets, they generally recommend against using any of these medications in pregnancy. The reason I say you can use it if your symptoms are severe is because we know from studies of patients who have asthma, when they have severe asthma, they're able to use inhaled steroids, and that doesn't seem to cause any harm to baby. So that's why we think it's okay to use it in the nose. But generally, if your symptoms are not too bad, I advise my patients to avoid steroids and antihistamines during pregnancy and try to use something called a nasal douche, which is a saltwater rinse for the nose. That helps to remove the actual allergen from inside the nose to reduce the response that you have.
Okay, but that sounds like a good idea. Just taking off, would you advise patients or our listeners to buy a saline rinse from over the counter? Would they make up their own? And if they were to make up their own, how would they go about doing that?
Well, I think it really depends on the individual, because it can take you some time to make your own nasal douche at home. But essentially, we are using boiled, cool down water with sodium bicarbonate and some salt solution to make the nasal douche, which can then go inside the nose. But I would initially recommend most patients to buy a device to deliver the douche into the nose, because it can be very difficult to sniff the fluid up into your nose using just your hand.
Yeah. And what type of device would you suggest? A pipette or a syringe or something like that doesn't, obviously the syringe that doesn't have the needle, but
you can use a syringe, but there are some very good commercially available nasal douches, like neti pots or bottles that you can squeeze the douche up into your nose.
Okay.
I generally recommend those. There are some that are available as saltwater sprays.
Okay.
And I don't know if you'd want me to mention specific brands or not.
Yeah, I think that would be okay if we were to mention, just so it would signpost patients to. I know Sterimar is one, and I sometimes ask patients about Neilmed sinus rinse as well. Yeah,
so basically the two douches are different because they use a different volume, and there's a different amount of pressure that's placed on the sinuses. When you use a Sterimar, it essentially produces a saltwater spray. That can be useful if you have mild symptoms, or if you have a little bit of crusting, or if you can't tolerate the higher volume douches like the Neilmed sinus rinse. Some patients, when they put the NeilMed sinus rinse into their nose, it can cause pressure in their ear, or even occasionally cause some of the douche to go into their middle ear. So for those patients, they generally tend to avoid using the NeilMed. But as a general rule, I generally advise my patients to use the high volume, low pressure rinses like the NeilMed sinus rinse first. That would be my recommendation. But they can be a little bit expensive initially to purchase.
Yeah, and you advises obviously with that in pregnancy, yes, that there is the safety factor around that they are safe to use. And one thing I
really want to stress is so important, and I don't think that people realize. People use tap water inside their sinus rinses, and actually tap water is not sterile. So you have the risk of douching your nose with a bacteria if you use straight tap water or even bottled water. So it's very important that if you are going to use a douche that you're going to make at home or assemble at home, that you use water that has been boiled and then cooled down.
Okay.
So that there's no bacteria in there. There have been some cases reported of patients getting very serious infections from using tap water in their nasal douches.
Oh, wow. Okay. I think that's really interesting and something that I wouldn't have known. So, listeners, if you're listening to the Body, Health and Mind show, have just joined in, we have Mr. Ali Qureishi, who's an ENT consultant at the John Radcliffe Hospital in Oxford, who has joined us, and we're talking about nasal and sinus problems. And Mr. Qureishi has just told us a little bit about the structure of the sinuses and their function, as well as the nose. And we were talking about rhinitis in pregnant ladies, and the safety and the types of different steroid sprays. And the very important point, I think, which is a golden nugget of information, is that tap water, we do run the risk of, if you douche your nose with tap water, running the risk of contracting bacteria through that water because it's not completely sterile. So the advice is to use cool boiled water at home and then use that in the douche, or buy an over-the-counter preparation, as Mr. Qureishi has advised. And obviously in pregnant women, Mr. Qureishi, the chances of having a rhinitis or nasal congestion is far more because the blood vessels dilate, don't they?
Yes, that's right. It's actually very common to get rhinitis during pregnancy.
Yeah. Okay. And it's also very common to get epistaxis or nosebleeds during pregnancy as well, isn't it?
Yes, that's very right. Yeah, because the blood supply, the circulation is much faster during pregnancy, and you can get dilation of blood vessels, and that can happen also. Yeah.
Yeah, I can remember in my time as an ENT, they used to call them SHOs in those days, but they're probably CTs now.
My wife had terrible epistaxis during her pregnancy. I remember that.
Oh dear. Okay. Yeah. Yes, and it's horrible because you've got to put the, was it rapid rhino? I remember putting in. Control
it. That's right. Then we put balloons inside the nose to control the bleeding.
Yes, and so it was very painful for the poor lady who was pregnant. It really was. So I remember treating a few pregnant ladies. So I hope that has helped some of you in terms of sort of rhinitis as well. Now, Mr. Qureishi, when would you advise on allergy testing for people who exhibit symptoms of allergic nasal rhinitis that is perennial?
Well, I think it's very difficult, actually, because allergy testing is not perfect, and it's very difficult to test for every single thing that may be causing an allergy. The perennial causes that we test for in our hospital are essentially the house dust mite, and for pets, so dogs and cats and other animals that people may have at home. The reason for testing for those specifically is because if your symptoms are terrible and you have a cat at home, for example, and you can't cure your symptoms with a spray, having the test done may then confirm that it is the cat, just so that the patients are better informed about what changes they may be able to make at home. And some patients in those scenarios, they give their cats away to some other family member. But I found most people tend to keep their pets, irrespective of whether their symptoms are bad or not, because they form such a good bond with them.
Yeah.
But that's when I would only really test someone for something if they fail to respond to the steroids. And you mentioned before, I didn't say, you mentioned before about the failure of steroid sprays to work. Most patients that we see in the hospital who say that the steroid sprays don't work have only used them for maybe 1 or 2 weeks. And when they've not received a response in 1 or 2 weeks, they think that they're no good and that they need something else done. But actually, we know that it can take about 4 to 6 weeks for those sprays to reach their maximum efficacy. So I think it's important that when patients are suffering from rhinitis, that they do persevere with the nasal steroid sprays.
Okay, so that's one message as well that Mr. Qureishi has given to you all, that it's important to persevere with steroid nasal sprays. And in fact, we do know that sort of akin to that in asthmatics as well, when we put them on steroid inhalers because they're not controlled with the reliever, that it does take for more than a fortnight for the levels to build up to cause some type of a relief of symptoms. So I'm assuming that steroid nasal sprays work in the same way.
Yeah, and we know that the upper airway and the lower airway are actually connected. There's a lot of research to show that allergic rhinitis and asthma coexist in many patients. We also know that nasal polyps and asthma coexist in many patients. And actually, there's a lot of evidence now to suggest that there's a similar underlying immune response of the body to allergen, something out there that causes you to develop your asthma symptoms or your rhinitis symptoms, or indeed even to grow nasal polyps inside your nose.
Okay. Now, moving on to polyps. We do have 3 minutes left. Moving on to polyps. How do polyps come about to grow within the nasal cavity? And what are they? First of all, I think what are they? That would be good to tell our listeners.
So nasal polyps, generally speaking, are non-cancerous, benign growths inside the nose. They look a bit like grapes, really, when they grow inside the nose, and they extend from the lining of the nose. The exact cause for their growth is not completely understood, but it's thought to have, in some patients, an allergic response to something, or potentially to fungal spores.
Right.
In some patients, it's due to previous infections, and particular bacteria like the Staph aureus bacteria have been implicated in their growth. And in some patients, it's believed to be due to problems with their immune system. So they grow from the lining of the nose to a various extent. Sometimes they block the sinuses. And if you remember, I mentioned at the beginning that the sinuses are like rooms attached to a corridor. If the polyp grows and obstructs the doorway between a particular sinus or that room and the corridor, then patients can get pressure symptoms or buildup of mucus within that room. And that's when they can present with pus from their nose or a bad smell inside their nose.
Right. Okay. So obviously there are various modalities in which to treat polyps, but we will be moving on to a break, hopefully, in the next 30 seconds. It's brilliant that we've spoken a little bit about sort of rhinitis, etc. I know after the break we'll talk a little bit more about the other conditions like sinusitis, etc. When to treat with antibiotics and when not to. I think we'll have a bit of nice guidance that will be coming in here. Thank you so much for staying on board. Please stay connected, because we will, after the break, be taking some questions from listeners and talking a little bit about the sinuses. Thank you very much, Mr. Qureishi, and hopefully we shall see you after the break.
Stay tuned to Salam Radio after this short...
Amazing show.
Thank you.
You want to just text him to say that he's not on camera during this 4 minutes so he can get a drink or
Okay.
chill out and scratch his head or whatever.
Yeah.
I've turned him off, but you're still on.
Thank you. Thank you. You know, the red thingy never came on as well.
I don't know how to do that. That's something that none of us know how to do. It just either does it or it doesn't sometimes.
Okay.
But you're on the ball anyway, so that's good.
So I was like, so as it was going 57, 58, 59, I was like, see you after the break. I was like, okay.
I don't know what to do, whether to press that play or whether that will just play.
Oh, is it silent? Let me talk to Brother Zairabas. Hello, Assalamu alaikum, brother. I'm on my show. Can I give you a ring when I'm out?
I want it all. I want it now. Forget about the consequences. I know that it's bad. It's better to wait. But sometimes I can't be selfish, and the only sound I hear is right now. And all my patience gets locked out. I know that it's wrong, and I wanna change. I need you here with me. Allah, 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 save me from myself. Allah, 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 Lord, I need your help. Allah, 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 save me from myself. Allah, Allah, Allah. Big lights pull me in every time. It's so hard to break a pattern, but I see clear. What's deep inside is the only thing that really matters. So tell me how to turn it around before my senses hit the ground. Cause I know that it's wrong, and I wanna change. I need you here with me. Allah, 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 save me from myself. Allah, Allah, Allah.
Broadcasting 24 hours a day, 365 days a year. This is Salam Radio.
Assalamu alaikum and welcome back. I don't think we ever really went, did we? Well, on that note, Brother Zahir Abbas gets a shout out on my show. Thank you very much, Brother Zahir, for your wonderful observance of this show and your dedication to the show and to the Body Health and Mind show and to Salam Radio. You are indeed absolutely super duper. And the other person I want to give a shout out to is Reis, who's this little boy. He's so brave. I saw him at some point during this week, and you know what? He couldn't bring himself to give me a smile, but I want him to smile because I'm giving him a shout out. So if you're listening at home, wherever you are, in Peterborough, Reis, I want you to smile because I promised I'd give you a shout out on the show, and I have. Okay? So there you go. Well, we were having a wonderful conversation with our most eminent guest, Mr. Ali Qureishi, who is a consultant ear, nose, throat surgeon at the John Radcliffe Hospital in Oxford. And he's also the lead for anatomy. He's given us some wonderful information about the nasal anatomy, the sinuses, what their function is, how polyps grow. We've spoken a little bit about nasal sprays and rhinitis and nasal congestion. And now we were talking about polyps. I was going to say politics. I think it's in the air. But we were talking a little bit about polyps, and we came to a break. Are you still there, Mr. Qureishi?
I'm still here. Yeah, I'm still here.
Thank you very much for joining us again. So we were talking a little bit about polyps beforehand, and we wanted to speak slightly about the treatment for polyps. Now, the treatment for polyps isn't very easy, is it? Because they can be persistent, can't they?
Yeah, that's right. And it depends really on the patient. Some people have very minor polyps that don't really cause many symptoms, and they have them for many years at a time. And then you get the other extreme, where the polyps can actually come out of the nose, and you can actually see them hanging out of someone's nose, or they can cause the shape of the nose or the skull to slightly change. So there's a big spectrum of nasal polyp disease.
And with regards to, obviously, that the grape-shaped type of polyps that cause nasal congestion that are more allergy-related, is there any point in what are the chances that these could shrink with using steroid nasal sprays, and over what period of time can one expect to see improvement in symptoms?
Well, I think if the polyps are so large that they're coming out of your nose, I think that medical treatment is unlikely to be successful.
Sure.
That's very unusual for that to be the case. So I think the vast majority of patients will respond to some degree with the use of steroids.
Okay.
Generally speaking, for primary care, we recommend, or this is actually based on European guidelines that were published in 2012, and they're actually being updated at the moment, due to come out next year. But we ask our GP colleagues to prescribe a regular nasal steroid spray or nasal steroid drops. The drops can be quite potent, actually, and they can have a big effect on shrinking up nasal polyps.
Okay.
Usually the courses last for about 6 weeks, but again, the way that the steroids are put into the nose is extremely important. For anybody who's taking steroid drops at the moment, I want to remind you that if you put the drops into your nose and you taste them very quickly, then you're not putting them in effectively. You must have your head right back or have your head right down so that the steroids soak into the polyps within your nose and don't just run straight down your nose and into your throat.
Sure.
That's important. And that the use or the way in which we put the medication into the nose is directly related to how effective it is likely to be.
Okay. Well, that's very important. Often, and I don't, I'd please do correct me if I'm wrong, I often say with these nasal drops that a person should have their head sort of bent back to the extent that their nostrils are sort of facing the ceiling. Would you concur with that?
Yeah, I think that's for anybody who can do that. That would be great. That's really good position to be in. It could be easier possibly if you're lying down in your bed to hang your head over the edge of the bed backwards.
Mm-hmm.
And if you have a neck problem that stops you from leaning your head all the way back, then you can lean forward.
Okay. Now, I have some questions from listeners over here. We have a Brother Qassam Mohammed. Thank you very much for coming onto the show and tuning in, Brother Qassam, who has asked, Assalamu alaikum, do you advise boiling the water and not to have the water straight from the tap? That answer to that is yes. And is filter water sufficient?
I think it depends on what type of filter you're using, but generally speaking, I don't think that any filters that I'm aware of will completely kill bacteria within the water that we have. So I think to be safe, it's best to use boiled and then cool down water. Okay. Unless you know for sure that the filter that you have is bactericidal and it kills everything.
Okay. And I hope that that's answered your question, Brother Qassam. And he's also asked a further question. Would you recommend an air purifier?
I think if you suffer from hay fever and pollen is a big problem for you, then I think an air purifier can be very useful.
Mm-hmm.
Otherwise, there are many benefits to having an air purifier that had been described, reducing the effects of pollution and such. So I don't think there's any harm in it. But in terms of my experience with regards to the nose, I think that air purifier is most useful for patients who have hay fever so that they can use it to filter out the pollen in their house.
Okay. So that helps with actually filtering out the pollen. And from my own perspective, I've been sort of advised that sometimes smearing the rim of the nostrils on the inside with Vaseline can be quite helpful in trapping pollen. Is there any way to substantiate that? Can that help?
Yeah, it definitely does help. And actually, honey and wax mixtures have also been shown to do similar effect. There are a few commercially available products that you can buy from Amazon or from Boots or Tesco or whichever pharmacy that you go to, and they're a bit like Vaseline, but they contain some honey extract in there. They work very well also. Okay, wow, they work on the same principle that they trap the pollen on its way into your nose so that it doesn't hit the lining of the nose. And also, if you put it on the inside, just on the inside rather than just on the edge, it can cover the pink bit of your nose at the very entrance of your nostril, so that the allergen that's likely to cause the swelling doesn't get onto the lining of the nose. There's a physical barrier protecting you.
Okay, that's very, very interesting, because this is the first time I've ever heard about honey and wax preparations as well. So very, very interesting indeed. And I think a lot has come out.
Myself, I have terrible hay fever, and I found using them, I didn't have to use sprays for most days. So yeah, they can be very effective for some people.
That's amazing. So you would take these honey and wax preparations that are brought from, say, a chemist like Boots, etc., and just smear them on the inside of your nose.
That's right, yeah, and then that's it. You're good to go. The other thing, if we're talking about allergic rhinitis, the other thing I would recommend is to take your antihistamine tablets very early on in the day. So I would recommend you take them straight away as soon as you wake up in the morning, so that the antihistamine is in your bloodstream before you're actually exposed to the allergen. So before your body starts to have a reaction, you've already got the medication on board. For most patients, once the reaction has started, the antihistamines can stop it getting worse, but it's unlikely that they'll get it completely better. So it's important to prevent the whole process starting in the first place. And actually, if you know you suffer from hay fever and you know you get it in the springtime, it's good to start taking your antihistamines probably a week or two, at least 2 weeks before you actually get to that point in the year when your symptoms are really bad.
Okay, so it's good to hear that, and hopefully it would give a lot of information. I've got a question here see, after the break, usually the questions start flooding in and it's difficult to try and move on to the next topic, but it's good that we're getting questions, which shows the level of interest that the programme has generated. I've got a message on my phone from someone who wishes to remain anonymous, stating that once upon a time we were able to have Grassix injections to prevent against allergic reactions. Why are they no longer available?
Well, I think that's a difficult question for me to answer, really, because it depends on the funding. There's a lot of things, unfortunately, that we used to be able to do, but the NHS is not funding at the moment. Sure. And I have my own conversations with members of the CCG and with the hospital trying to get additional treatments. But whenever you're working in a public system where there's finite sources, I think you have to rationalize what you can and can't provide people.
Yes.
And unfortunately, Grassix, which some of your listeners may not know what that is, that's actually something to prevent grass allergy or hay fever for some people. It's not funded on the NHS at the moment, but I think in some special cases you can still get funding.
Okay, I see. And it's still available for those that wish to use it privately, is that right?
That's right. Yeah, as far as I'm aware, you can have it as a tablet or you can have it as an injection.
Oh, okay. So I knew about the injection. I wasn't aware of the tablet side of things as well. What does it actually do that other preparations or medications don't do?
Well, I think the basic principle of using this particular medication is that it exposes your body to very low doses of the allergen over a period of time, to allow your immune system to develop a natural defense mechanism against that particular allergen.
Right.
Unfortunately, when you stop using the medication, for most people, the symptoms start to come back. So it is a long-term and quite an expensive treatment.
Okay, so it is very actually advised that one should look at precautionary measures and
Absolutely.
Then treatment. Grassix in itself, you can't really take it during the season either, can you, Mr. Qureishi? You've got to take it a few months before, is that right?
That's right. Yeah, you have to take it before, and this is one of the particular conditions in which allergy testing would be very important. Because let's say, for example, you were considering taking Grassix, or you're thinking of going privately to take it. If you were also allergic to certain weeds, or you were allergic to rapeseed pollen, for example, then the Grassix may help against your grass allergy, but it won't stop the other allergens that you have, and actually you would not have a good response to the treatment. So this is another scenario in which allergy testing is very useful in helping to determine if you have a single cause of your allergy.
Okay. Well, I think that's been wonderful. You know, we've spoken about polyps, spoken about rhinitis and sort of treatments as well. Now, moving on to the sinuses, which are those little rooms in the house that you spoke of just at the beginning of the show. Nowadays, with the flu season setting in, I see relentless numbers of patients coming through the door saying, I'm completely bunged up, there's nothing coming out, I've got a terrible headache, and I feel awful, I feel sick, I feel down and out, and my sinuses are tender. Would you like to tell a little bit about what sinusitis is and how it is, how it comes about, and what patients can expect in the way of symptoms?
Sure, but I think I have to say, Dr. Shabina, that I think you're probably a lot more experienced than I am in treating acute sinusitis, because we generally only get to see the patients who have very, very severe sinus infections,
Sure.
causing complications. But essentially, sinusitis is inflammation of the sinuses. That's what sinusitis means. And it occurs when the sinuses become blocked or their natural drainage becomes blocked. So as I mentioned, if the doors are blocked by something, and that's usually caused by inflammation, so swelling of the lining of the nose. The nasal sinuses can then fill with pus, and that can be very unpleasant. So that's why when you blow your nose, green or yellow stuff comes out from your nose, because they're full of pus and bacteria that's trapped inside there. And it can cause pain and temperature, headache, generally feeling unwell, poor sense of smell, poor sense of taste. It can be very unpleasant. For the overwhelming majority of patients who get sinusitis, it's viral. That means that antibiotics will not work. And so please, we would always recommend you not to use antibiotics to start with. For these patients, the best treatment would be to use painkillers like ibuprofen that can be very effective, and to use a nasal douche or a nasal decongestant, something like Otravine, or there are many other decongestant solutions available, or Sudafed. But you should never use those decongestants for longer than a week, because after that they can cause some harm to the nose. Mm-hmm. That's what I would recommend to most patients initially. Sometimes what can happen is you get what we describe as a double sickening. So you become unwell with your sinusitis, and you feel terrible. 3 or 4 days later, you start to feel a little bit better, but then all of a sudden you suddenly become worse again. Mm. That's probably when the bacteria's got in.
Sure.
When you have a virus, you're a bit more susceptible, your immune system's a bit weaker, and that's when the bacteria that are probably living in your nose anyway, not causing any harm, they can take advantage of that fact, and they can cause bacterial sinusitis. And then that can be a bit more severe.
Sure. I think I completely sort of agree with you. And in many cases, we do see quite a lot of patients. As GPs, we're always given the NICE guidance. And I can remember for the last year, our practice was actually sent a very sweet letter by the Chief Medical Officer, Dame Sally Davies, saying that our prescribing rate of antibiotics was way above what it should be, which wasn't very good to hear. And we were instructed to implement more of NICE guidance, which we did. And one of the things regarding sinusitis that NICE states is that anybody that's got more than 3 weeks of symptoms, looks very unwell, or appears to be clinically very unwell, and has a high temperature, and probably has a background of complications such as heart disease or asthma, etc., may benefit from a course of antibiotics. And recently the guidance has changed. They've advised us to use as first line treatment penicillin, haven't they? And before that it used to be, was it doxycycline? So doxycycline is second line. Now phenoxymethyl penicillin is used as first line. And that's just only sort of in the last year or two changed. And before that I think it was amoxicillin, if I'm not wrong. But yes, we've seen that. So a person that comes to you with chronic sinusitis, obviously not getting better, what do you do with those patients?
Well, for patients, I mean, in hospital, we define chronic sinusitis as sinusitis that's lasted for longer than 12 weeks. Mm-hmm. Anything that's less than 12 weeks, we consider it still an acute form. And for us, there are two particular types of patients that we see. There are those that are really worrying. So if patients present with sinus infections that may be affecting their brain by causing symptoms of a meningitis, or patients who present with sinus infections that are going into their into their eyes, affecting their vision or causing abscesses to form on their face. Those patients are treated very acutely, and we would usually admit those patients and potentially would need to operate or drain those infections. The other type of patients that we see are the patients who have not responded to your first-line antibiotics. And for patients, I would generally use Augmentin as my first line for patients who don't have a penicillin allergy. But that's really based on the guidance from my local hospital, because every hospital will have its own guidelines that are based on the bacteria that are generally known to cause problems in your local area.
Sure.
And when it gets to a chronic stage, when it's beyond 12 weeks, then we stratify the patients according to whether they do or they don't have evidence of nasal polyps. And when there is the presence of nasal polyps, we usually give doxycycline. Okay. And that's based on some studies that have shown doxycycline is more effective. And when there are no polyps, I should say, we use clarithromycin. Because that not only fights bacteria, but it also reduces inflammation inside the sinuses. So it has a dual benefit.
Okay. Well, that's really interesting as well. That's something new that I've learned from that perspective too. Now, you're absolutely right that different areas, according to the hospitals, have different sort of antibiotic prescribing policies, which are very important to follow. And obviously, we look at sort of the patient and what other comorbidities they may have that can also sometimes lead you into treating them. When would you think of surgery as an intervention, Mr. Qureishi, for somebody who has chronic sinusitis? And how would they get to that stage?
Well, usually by the time we make a decision to do an operation on someone, we would have performed a CT scan. The CT scan is very useful in helping to confirm that the sinusitis is ongoing, show you where the infection is. One of the things that we do frequently see is patients who have very bad dental disease affecting their upper teeth, causing inflammation and infection inside the sinuses. So in those cases, we would ask the patients to see their dentists, and often if they have a infected tooth treated or removed, that can resolve all of their sinus symptoms. Otherwise, for patients who've not responded to medical treatment, and that varies slightly, but generally speaking, we'd expect to treat a patient with maximum medical therapy for at least 3 months. And if they fail to respond and they continue to have significant symptoms, then we offer them surgery. And one of the problems is that symptoms can be subjective. So one patient's symptoms may be different to another's, although their scans may look very similar. And so we use different assessment tools to judge the impact of the symptoms on patients' lives. And we know that depending on the score that patients have, how beneficial surgery is likely to be for them. And that can help us to guide patients towards surgery. But it's very important that if you are considering or have been offered surgery for your sinusitis or for your nasal polyps, that surgery is only a part of the treatment. It is very rarely a cure for someone with chronic sinus infections. It's usually more effective for treating people who have an acute infection or who have a isolated sinus infection, which is one or two areas that are infected.
Okay.
Sinus surgery effectively improves the delivery of medication into your nose. So any polyps or pus that's there is removed, and then the sprays that you use can work more effectively to shrink down the inflammation in the lining of your nose.
Sure. Okay. So that's given quite a good perspective on what next steps need to be taken in the case of antibiotic therapy sort of not being enough or failing, etc., which is great. And obviously, just for the patients or the listeners' information, this is carried out under a general anaesthetic, isn't it? These operations.
Generally speaking, sinus surgery is performed under a general anaesthetic. I do know some colleagues who do sometimes perform a surgery under a local. Going back many years, I mean, before my time operating, sinus surgery and polyps were removed under local, but that's something that we've generally stopped doing. But in some cases, in patients either who are too unwell to have a general anaesthetic, or when the polyps are very small or isolated, they can be removed under local, but there's only a very few centres around the UK that I know that offer that service. It's not routine, certainly. It's not a routine thing.
Sure. That must be... I'm just thinking about the whole... There was once upon a time, I can remember, I don't know whether this was a Roald Dahl book or that spoke of children having their adenoids removed as well well, there was no anaesthetic at that time, but that was way, way before. I think it was probably in the World War eras. But yes, how technology and how science has changed, and we don't need that anymore. But
I had a colleague who had her tonsils removed under a local anaesthetic when she was a child.
Oh my goodness.
That was in Romania, though. That wasn't in England.
Okay.
She was quite traumatized by that.
I can imagine. Yes, it is, because you've got to... The mouth has to be considerably open to gain access to the tonsils. Yeah. So, yes. Yeah. Wow. So, we've come to the end of our show now, Mr. Qureishi. It has been... We've always run out of time on these shows, and I really wish that we would have more time, but it's been such a pleasure having you on board, and I'd really like to thank you on behalf of Salam Radio and the listeners. We've had an amazing engagement. We've had lots of people that have tuned in. So, thank you ever so much.
Thank you for having me. I appreciate it very much. Thank you.
And hopefully, inshallah, in the future at some point, we'd love to have you on again.
Of course, yeah, it'll be a pleasure. Thank you.
Thank you very much and have a very good evening.
Assalamu alaikum.
Thank you. Wa alaikum assalam. That was Mr. Ali Qureishi, an ENT consultant from the John Radcliffe Hospital in Oxford. Now, a few announcements. As you know, we've got Radio Local, which is a one-day radio making workshop for young people if you're interested. And join Hunt and Darton for a whistle-stop tour of the world of radio presenting. It's a free one-day workshop which will get your fingers on the buttons and your voice on the airwaves, introducing you to the key skills involved in hosting a show on the radio. It's suitable for anyone aged 12 plus, so definitely do join if you want to. It's taking place on Saturday, the 19th of October, from 10 a.m. to 5 p.m. So the tickets are available from Eventbrite, and you'll be able to go onto the Salam Radio page to have a look. We've also got at Gladstone Connect Seniors Club at the Iqbal Centre, 157 Cromwell Road, PE12EL, every Thursday from 2 to 4 p.m, starting on the 17th of October, where there will be talks, arts and craft, yoga, meditation, music, dancing, games, quizzes, friendship, food, afternoon tea. Wow, I'd like that. And gentle exercise. For further information, you can contact Richard on 01733 756 275. So, after all of that, it's been absolutely wonderful. We do have a comment from a sister, Shamila, who would like us to do a little bit more on epilepsy in children. Sister Shamila, I am definitely going to be doing a topic on epilepsy in children. So thank you very much for bringing that to my attention. Next week, there won't be any show. I will be joining you the week after next. It's been an absolute pleasure to host the Body, Health and Mind show to all of you, as it always is, with our wonderful group of volunteers, with our station manager and everybody else who's behind the scenes working hard. Please remember us in your du'as, as I will remember all of you too. And until then, keep wrapped up warm and wait for another Body, Health and Mind show on Salam Radio the week after next. Assalamu alaikum.
You're listening to Salam Radio, and it's now time for Isha Azan. This Azan is sponsored by UK Islamic Mission, serving humanity since 1960.